To our top story first. It's been nearly 2 weeks since a commercial LPG shortage began tightening its grip on the F&B and hospitality sector across the country. Now, as governments begin rationing out LPG cylinders for commercial use, the Bengaluru Hotels Association is an unhappy lot. Now, as per the rationing plan drawn up for Karnataka, around 1,000 out of 9,000 LPG cylinders set aside for the commercial market in the state will go to restaurants. The government's reasoning is that the rest of the supply must be set aside for healthcare and other essential sectors. Restaurateurs, however, have pointed out that 1,000 is too few and simply won't do for 40,000 restaurants across Bengaluru. The association has said it plans to write to the centre and request the government to correct the math. Now, it isn't just LPG that's in short supply thanks to the war in West Asia. As Eid approaches and well into the month of Ramadan, dry fruit prices in Hyderabad were already on an upward trajectory. However, the escalation of tensions in West Asia has impacted prices of pistachios and almonds even as a supply crunch has manifested in the market. According to some reports, prices across dry fruit stores in Hyderabad have seen a 30 to 40% surge over the last 2 weeks as supply routes from West Asia remain under stress. Remember, India relies heavily on markets like Iran and Afghanistan for the procurement of almonds, pistachios, apricots, raisins and saffron. With the conflict impacting ports and land routes alike, supplies have been under stress. Meanwhile, as the war rages on, a 21-year-old maritime trainee from Kerala's Kollam has been stranded for nearly a month on an Iranian cargo vessel off the Sharjah coast. His family has now begun seeking urgent help to bring him back. The family, in fact, of Arjun Saji has claimed that the sailor has been struggling without proper food or pay. They have now approached authorities at the Indian embassy with a request to intervene and help bring the sailor back. Moving on to more news from the F&B space next. Not to sound cliched, but in what can only be described as the end of an era, Florida-based Hard Rock International has decided to shut its chain of Hard Rock cafes across 10 locations in India. Among the cities impacted are Bengaluru, Hyderabad and Chennai, which together account for 6 out of these 10 Hard Rock cafe outlets in India that will now down shutters. Now, the development comes as Hard Rock International has decided to end its agreement with JSM Corporations and other entities which held the rights to run all Hard Rock cafes and stores in India. The move, however, will not apply to the Hard Rock Hotel in Goa, which is operated by a separate entity. Earlier today, I reported on what the development means for Bengaluru, which saw South India's first ever Hard Rock cafe opened back in 2007. Take a look. The iconic Hard Rock Cafe on St. Mark's Road in Bengaluru is all set to shut down after Florida-based Hard Rock International pulled the plug on its franchise agreement with JSM Corporation. That is the company that operated all Hard Rock cafes across India, all 10 of them. Now, what that means is simple. Every single Hard Rock cafe in the country, including all 3 in Bengaluru, will now close their doors for good. But for this city, the St. Mark's Road outlet, its closure, it's different. Opened in the late 2000s, around 2007, this wasn't just a restaurant. It was Bengaluru's introduction to a certain kind of nightlife. Before the microbrewery boom, before Indiranagar became what it is today, this was the place for live rock music, big nights out, and a certain global vibe that the city quickly embraced. Now, generations of Bengalurians, many in recent times, have walked through these doors for gigs, celebrations, dates, and everything in between. And while the reasons may be corporate, a global brand exiting a local partnership, the impact is deeply personal. Because what's shutting down isn't just a business. It's a piece of the city's cultural memory. So as the lights go out on St. Mark's Road, Bengaluru still isn't just losing a cafe, it's saying goodbye to one of the places that truly made the city feel like itself. Moving on, months after it first announced a partnership with Bengaluru-based Narayana Health, drone and air logistics startup Airbound has said drone deliveries of diagnostic samples to testing centers are presently underway. Both companies have reported 700 plus flights in 54 days with no failed deliveries by way of a pilot project. What the partnership now does is allow Narayana Health to centralize all its testing and lab infrastructure at its Narayana One Health Clinic in Electronic City, as opposed to multiple labs across the region. This even as both companies have said that these drone deliveries will eliminate road logistics of these samples. I caught up with Dr. Devi Shetty, chairman at Narayana Health, and Airbound founder Pushp to get the lowdown on what else the partnership means for both companies and its patients.
We knew that finally the drone is the only options available for us to shift blood sample from different parts of the city.
Right.
It is pointless creating very expensive labs with huge manpower for every hospital. There is no need. We are in the process of building about 4 or 5 hospitals in Bangalore. These are paperless smart hospitals. In this hospital, only the people who are going to touch the patient with scrubs are going to be working. All the others will be remotely working. These hospitals will not have laboratories to test the blood. They won't have the blood bank for processing the blood samples. Everything will be done in our big flagship hospital in Electronic City, which does over 25,000 tests every day. It is one of the largest labs in the country, and all the samples from our hospital will reach there with the Naman's drone. And by doing it, first thing is results will be very, very accurate because of a huge infrastructure and expertise. And cost will go down dramatically. And also patients will have the results in no time.
Absolutely. And we'll discuss all those parameters in just a bit. But Naman, quickly over to you. The last time we spoke, we were talking about the various details surrounding getting the pilot off the ground, regulations that will surround its actual daily operations itself. Where are we at this time and place with regard to both of that? I believe 700 plus flights over 54 days. That's part of your pilot, presumably. What do you see panning out henceforth with regard to the numbers itself, even as you chart this out to be a daily affair of sorts?
No, absolutely. And I think one thing I want to say is it is already a daily affair. Every single day, including right now, there are samples being flown from Chandapura to Narayana Health City. Right now, again, if you go to Chandapura, every single sample is being flown via drone. So this has very much become a part of daily life. And I think it has definitely, while we're still in that pilot period, this has gone far beyond a pilot. What we are really excited to do as things scale up is both, as Chandapura matures, see how patient behavior starts to change as people get more used to this service, right? See how volumes potentially expand, how we're able to increase operational hours, and how we're able to provide better quality, to people coming to the clinic. And what is definitely very, very exciting is scaling towards the Banshankari pilot, where we can start to do this at a much larger scale with much larger volumes. Right, I think the scale of the Banshankari pilot is going to be orders of magnitude larger than what we've seen at Chandapura. And we now have, the manufacturing, the operational, and the tech capability to handle that scale.
Right. So that 700 plus flights that you've seen in 54 days, where will that number go from here, even as these plans take form and shape, Naman?
Absolutely. I think it's obviously very hard to predict how the numbers will scale up. But I do see us comfortably getting to a point where, this flight volume that you've seen built over, 2 months will comfortably be built over a week. And hopefully as things scale up, you'll get that to that flight volume within just a day or even a few hours.
Absolutely. And doctor, you spoke about a cost reduction of sorts by way of enhanced logistics itself. Air roads completely replacing the roadway that, these medicines or these diagnostics tests would normally take, especially in remote areas. What kind of a reduction in cost do you foresee actually taking form and shape by way of drone deliveries itself?
If the samples can reach our hospital, where we do the tests in large numbers, over 25,000, 26,000 tests, then the cost can go down by less than 50%. Yeah, dramatically.
And that is, of course, a very dramatic decline. So what
Yes.
will that do really to your business itself? Do you see larger volumes happening by way of enhanced deliveries via drones? How will that help business at Narayana?
Bangalore city today has at least maybe 5,000, 10,000 labs. And each lab does maybe 10, 20, 50, 100 tests. So they need to have technicians, machines, everything should be running. When you run small operations in labs, quality is a problem because it's dependent on the operator and also the cost. When you shift all the samples to few centralized labs, city like Bangalore may not require 5 or 10 labs. And if these labs embrace drone technology to collect samples, the cost of laboratory testing, the blood testing, and the blood bank services will go down dramatically.
Absolutely, a centralized area to go about doing all of this, thanks to drone deliveries itself. But Naman, back to you. The last time we discussed this, major point of discussion between the two of us were the regulatory hurdles that may have had to be overcome to actually see this becoming a day in and day out affair. Give me an update on that front. What are the regulatory hurdles like at this point in time? Have you pretty much ironed everything out? And what is it like on that front going forward?
No, absolutely. I think it's definitely a phased approach that we're taking. The nice thing is that we've gotten to a point where for routes like Chandapura, which are short distance in green zones, we're able to get regulatory approvals, and we're able to now just comfortably do flights. So DGC is fully in the loop. They're very happy with the way things are going. The next step with the Banshankari pilot is that while this is still a green route, while it's still free airspace, we are doing a much longer delivery path. We're getting into beyond visual line of sight flights, which has separate regulations. And so we're working closely with the regulators to get a specific exemption for this route, citing, the effects that citing the data and the results that we've seen from the Chandapura pilot to show that there are a lot of really great outcomes coming as a result of these drone deliveries. And not only that, we're handling operations very safely. There have been zero safety incidents, there have been zero failed deliveries. So we also want to say, look, the benefit is high. And because there is now a better understanding of the system, the risks are lower as well, which is why doing, a pilot at a larger scale like this makes a bunch of sense. And the broad vision beyond this is that we really want to create these case studies out of Chandapura and Banshankari to show that this is absolutely changing healthcare. While at a small scale, it is definitively changing the way healthcare works. And the only way we can really scale this up is to be able to work with regulators to get some form of blanket approvals where, we are able to get routes unlocked much faster, or we can, start, doing new deliveries, working with new clinics without, such a long process.
Right. How many more routes in the pipeline possibly are you looking at?
Oh, I think there are lots of routes that we can do with Narayana. I think Dr. Shetty may be better to answer that question.
Perhaps I'll turn that over to you, Doctor. Then, how many potential routes do you see actively being worked on to enhance these logistics?
Yeah, first of all, there are no regulatory hurdles. The regulations are there to protect us and the citizens.
But presumably for drones, there were, of course, a few bottlenecks that a lot of operators and manufacturers were talking about. So surely that may have been a challenge in the past, but you feel it's been overcome?
They're all opening up based on who's the operator and what the intention is.
Right.
So when a hospital approaches a regulator saying that this is what we want to do, supported by a technology company, things gets much easier.
Right.
So we are optimistic that we should be able to use the drone transporting system for blood sample from at least 5 to 6 locations across Bangalore in a short duration of time when our hospital get operational.
Absolutely.
So Banshankari is the first such pilot after the Chandapura clinic sample, because Bandapur is the Banshankari new hospital is a big hospital, so that should be able to transport hundreds of samples every day. That will give the regulator very clear picture of the safety and the efficacy.
Absolutely. And one last question to you, Doctor, before I let you go. Surely an operation of this scale, involving drones, involving a central facility for all these diagnostic tests to actually go about, should see some increase in capacities itself, given the volume of diagnostics that will actually make their way to the facility in Electronic City. What has work on that front been like? And what kind of enhancements do you actually see in terms of on-ground infrastructure and capacity to make up for the large volume of inbound diagnostics?
The existing infrastructure can manage about 25% more number of tests. We have already built in infrastructure, but we expect the workload to double in the next 1 year.
Right.
Yeah, that is the expectation, and we are putting all the infrastructure in place.
On that note, we'll have to slip into a really short break, but South Central continues on the other side with more news and updates from the region. Keep staying tuned to ET Now. Welcome back. You're watching South Central with me, Jude Sanith. This is the show where we break down everything that matters to South India across businesses, boardrooms, politics, policies, and more. Shifting focus to cricket now, but staying with Bengaluru. The race for ownership of the Royal Challengers Bengaluru, or the RCB, is heating up, with two Karnataka-linked heavyweights firmly in contention. Reports say that one of these consortiums is led by Manipal Group Chairman Ranjan Pai alongside global investors KKR and Temasek. The other key contender is Azim Premji's Premji Invest, partnered with Swedish private equity firm EQT, with both possible bidders bringing some Karnataka flavor as well as global capital. Meanwhile, Serum Institute CEO Adar Poonawalla, according to reports, is believed to have exited the race to wrest controlling stake of RCB. Shifting focus to politics next, the BJP has released its first list of 47 candidates for the 2026 Kerala Assembly elections, signalling an aggressive push in the state. Key names include former Union Minister Rajiv Chandrasekhar, who will contest from the Neemom constituency, as well as V. Muralidharan, another former Union Minister who will be fielded by the party from Karakotam. The party is clearly leading on high-profile leaders as the BJP looks to expand its footprint in a state where it has traditionally struggled to gain electoral ground. Staying with more politics from Tamil Nadu now, the Tamilaga Vetri Karagam, or the TVK, has denied being in alliance talks with the BJP ahead of the 2026 Tamil Nadu polls. The denial comes even as speculation was rife that actor-turned-politician Vijay was being offered the position of Deputy Chief Minister should he choose to ally with the BJP and the AIADMK in Tamil Nadu. The TVK has responded to these reports, saying that Vijay will not be deputy to anyone, thereby ruling out any speculation of a possible alliance. Meanwhile, the actor-turned-politician himself, that is Vijay of course, has written to the CBI urging the agency to conduct any of its further inquiries into the Karur stampede in Tamil Nadu instead of Delhi. The request comes even as the actor has been frequenting Delhi to participate in a probe that aims to determine his culpability in a stampede that took place at one of his poll rallies in Karur. Vijay has now said that he has election commitments and logistical constraints that prevent him from making any more of these trips to New Delhi for the purposes of that CBI inquiry. Well, with that, it's a wrap on South Central. Thanks so much for watching. We'll see you same time, same place tomorrow with more news and updates from South India. For the moment, it's goodbye from us.